Hi, this is Dr. Connors, continuing our series on understanding SNP defects. Now, SNP defects, again, stand for single nucleotide polymorphisms. These are polymorphisms, defects in genetic pathways. Genetic defects, usually epigenetic defects, caused from originally some environmental toxin or alteration into that gene that then is passed on to further generations. In this presentation, we're going to talk about CBS pathway. We'll get into what that is and the importance of hydrogen sulfide. So that's what hydrogen sulfide looks like for you chemists out there. And before we get into this, we need to go over some general rules with genetic testing. So if you've seen any of my presentations, I will list this on every single one. So when we're looking at genetic testing and testing for SNP defects, it's super important to follow these general rules. Number one, you do not treat the SNP defect. So you're not treating the defect per se. You're treating other factors of why it's there. You have to look at the whole person. You have to dig into the cause. On this presentation, we're not going to get too much into that because this presentation is the importance of hydrogen sulfide and why that is important in your body. However, you have to look at the cause because a person could have a SNP defect and live to 120 years old and it never affects them. But they have a SNP defect and then you add Lyme disease or H. pylori or a mold toxicity or heavy metal toxicity or enormous amount of stress or etc., and then that really throws the big picture off for that person. And it's not a matter of treating the SNP, it's a matter of getting rid of the Lyme. So even my Lyme patients really struggle with, well, we did the testing on, we found the defects, why am I not getting better faster? If you don't kill the Lyme, you're never going to get better. It's not about treating the SNP, but you have to know that so you can support that. You have to also look upstream and downstream. And when I show you the next slide of the chart, you're going to understand that. It's a huge complex pattern and it's all about balance. So we don't want too much of anything. It's just like my rule for nutrition. Too much of a good thing is a bad thing. It's about balance. So don't make the American mistake of, oh, one vitamin C is good for you, so I'm going to take 10 that will be really good for me. It's never that way, and it's not that way when you're looking at genetic testing also. Number four, we never use protocols. So that's my rule. We don't use protocols. We create a protocol based upon that patient. We create a protocol around that patient, but we get patients calling all the time. I have a MTHFR defect. What should I take? What's your protocol? There isn't one. You have to treat the patient, and then even at that, you're constantly tweaking, constantly tweaking. That's just the way it is. So this is what we're talking about, upstream and downstream. You do not treat the SNP. You have to treat the whole person, and then and only then can you really support the pathway. All right, does that make sense? Hammered that home enough? So we're looking at a metabolic picture of SNP defects. There's multiple tests out there. This right here is a doctor's data test that we use quite frequently. And the SNP that we're looking at when we're looking at CBS pathway and hydrogen sulfide is this one right here. So this is the CBS SNPs that we take a look at. And when you look at a big pathway planner, thanks to Dr. Ben Lynch of seekinghealth.org, there's a whole bunch of information on his, plug his website there too. He's a fantastic guy. This, where my arrow is, and what we're looking at when we're talking about the CBS pathway. And this is just a little snippet of that whole pathway. It's fed off of the methylation pathway, the methionine pathway, and the CBS is the start of the transsulfuration pathway. They all fit together in a beautiful giant jigsaw puzzle that if you're missing one piece, it can really throw off the big picture. But you have to look at the big picture. Now the CBS pathway feeds from this methionine pathway. CBS pathway is the only way that your body can get rid of homocysteine. So one of the indications that there's a blockage in the CBS pathway is on a standard blood test, the person has high homocysteine levels. So if the person has high homocysteine levels, it's a pretty good chance they're not pushing down through that CBS pathway and getting rid of homocysteine. Now there could be other issues too, but that's a pretty good indication. Now, this presentation is about the importance of hydrogen sulfide. So where we're looking at in this pathway, now this is a big picture here. What was circled in the pink on the previous pathway is still circled in the pink on this pathway, and the arrow is pointing to CBS because I know it's really hard to see this on this slide, and then that feeds down to this big circle on the bottom, which creates glutathione, which feeds into the Krebs cycle, which gets rid of hydrogen peroxide in your body, gets rid of free radicals, radical oxygen species, etc., etc. It's so important as kind of an antioxidant detoxification pathway, energy making pathway. Your Krebs cycle makes all your ATP, etc. So it's really, really important, and you don't want too much and you don't want too little. So now that being said, as a precursor, why is hydrogen sulfide so important? Because I read that hydrogen sulfide is not good for you. Matter of fact, in work environments that they're producing hydrogen sulfide gas, it's very toxic and can kill you. So that's very true. But we're talking about the hydrogen sulfide that's made intracellularly. Intracellular hydrogen sulfide does very important things in your body. It's a powerful antioxidant. It itself feeds the increase of glutathione production, and we're going to have a whole presentation on glutathione, so I'll leave that alone. It scavenges, meaning it goes and gobbles up superoxide ions that are so damaging and causes cell death and cell issues. Hydrogen peroxide, that's very damaging to cells, and peroxynitrite, which is extremely damaging to cells. So it's a great antioxidant and needed in correct concentrations. Now, remember, if you watched any of my videos on cancer, we always want antioxidants and anti-inflammatories, etc., right? However, remember that there is a balance. Even in this, there's a balance. You need oxidants. You need pro-inflammatory cytokines and chemicals in your body. Those are the things that kill bacteria, kill mold, kill Lyme. But when it's out of balance, it starts killing your own cells, and we have an issue. So it's all about balance. Everything in your body is about balance. So don't watch a presentation like this and go, oh great, I want to increase my hydrogen sulfide levels, so I'm going to do this and this and this because I want to really super increase my hydrogen sulfide levels. It's the wrong way to look at anything. Hydrogen sulfide also inhibits reactive oxygen species caused by hypoxia, which is very important for cancer patients. So there's multiple studies that show the hypoxia around cancer increases reactive oxygen species, and that can actually damage your own white blood cell attack on the cancer. So if a person has a CBS pathway blockage and therefore is decreasing production of hydrogen sulfide and glutathione, they are also increasing the ability for a cancer growth to grow unabated. So we want to look at these pathways with cancer patients too, because we may want to support that pathway with different nutrients that will help push that pathway and to help decrease reactive oxygen species that are produced by a cancer. It also inhibits COX-mediated inflammation. So pro-inflammatory cytokines due to chronic infection, etc., can have just huge damaging effects on a person, and that's what can lead to cancer again. So since my specialty is cancer, this is a big, important factor in how we look at patients. When you have chronic inflammation in the body, causes all sorts of problems, and it can lead to cancer. NF-kappa beta also is a source of chronic inflammation. It's an inflammatory marker as well. So are these cytokines. It downregulates IL-6, IL-8, and IL-1B. So here at the bottom is a picture of NF-kappa beta and the issues that it creates in your body. One interesting study talked about NF-kappa beta decreasing the ability for tumor necrosis factor to cause apoptosis in a cancer cell. So remember, apoptosis is the programmed cell death that is not taking place in a person with cancer. So that cancer cell is not dying and it's in a state of rapid replication. Well, one of the reasons that's taking that is happening is an upregulation of nuclear factor kappa beta. So NF kappa beta is upregulated in cancer, and it's not clear that if it was upregulated, therefore it is a cause of cancer, or is it upregulated by the cancer cell itself. Regardless, it itself protects against that cancer cell's death. So as your immune system is attempting to kill a cancer cell, the upregulation, the increase in nuclear factor kappa beta in a cancer cell blocks apoptosis. So it keeps it from undergoing death. So it actually inhibits chemotherapy. It inhibits, because chemotherapy is trying to increase apoptosis. So it inhibits the natural cell death of the cancer cell and keeps that cancer cell alive. Not good. So we want to do things that will decrease these inflammatory markers like NF-kappa beta and the COX-mediated inflammation, and it will help increase your ability to go through apoptosis. So again, this is a nice diagram of methionine, which was way up high on that other chart that I showed you, goes to homocysteine. Homocysteine then goes through the CBS cycle. That's what's called transsulfuration, and all sorts of good things take place. If there's a blockage and you have a hyperhomocysteinemia, which means you have an increased homocysteine, all sorts of bad things take place. Remember, it's all about balance. It's all about balance in every one of these cofactors and every one of these pathways. So it's not about just pushing one thing. It's about keeping a balance, because get out of balance in anything in life, and we can have issues. So this is another little snippet of that pathway. The CBS enzyme gene creates hydrogen sulfide in several places on the arrows on the right on this. And another little snippet, this is what we're talking about. Homocysteine goes through CBS to form hydrogen sulfide. Goes down through those other pathways to form all those other things that we'll hit on further presentations. But just in this presentation, wanted to hit number one, it's all about balance. Number two, when we're dealing with cancer or chronic inflammation of any kind, which is a chronic infection, which could be Lyme disease, which could be H. pylori, which could be any type of chronic subclinical infection that the person doesn't even know that they have. This is why H. pylori and such are causative factors of cancer. We're going to have a downregulated CBS pathway. So if we can help support the upregulation, if we can increase this pathway, increase hydrogen sulfide, and later we'll talk about glutathione, and this is exactly why a person with a downregulated CBS pathway has less energy, because they're not producing ATP. We'll get into that as well. But it helps us understand why things are taking place and where we really want to support different metabolic pathways, and how it can really help people with cancer, chronic Lyme, chronic fatigue, chronic disorders of multiple kinds. So I hope this helps. I know I speak really fast, and I apologize. Listen to this again. Hopefully it's not too technical, but I'm trying to simplify something that can be sometimes kind of confusing. All right, talk to you soon.